There was a strong genetic history of heart disease in my family. It was a known fact that I had to control my blood pressure. So I've been medicated and followed by a cardiologist for well over 40 years.
And I've actually known Sam for 25 years. Sam's the CEO of a large multinational organization. He's also a triathlete.
Being able to exercise outdoors is an important part of my life. I've done it virtually my whole life. I feel better, both mentally and physically.
Sam wasn't able to pick his parents, and both his parents had coronary artery disease as well. So regardless of the lifestyle he lived, he sort of started out with a hand of cards that really were stacked against him.
It probably goes back 4 or 5 years. I started complaining to the cardiologist that my times were deteriorating faster than my age said they should.
It was very alarming to him because he took that very seriously. And we actually did a stress test, and as I remember, the stress test didn't show anything.
Patients who don't exercise on a regular basis, we put them on a treadmill to stress their heart a little bit. But for Sam, putting him on a treadmill to walk was nothing. He was getting up and running 5 miles.
In June, I ran a sprint triathlon in Avalon and had chest pains during the run. But if I stopped and walked for 30 seconds and my heart rate came down, the pain went away and I just ran again. And that's when I made an appointment to come in to Lourdes.
Dr. Sailam saw him and immediately ordered a heart catheterization, recognizing the likelihood that, given his family history and his high blood pressure, that what was happening was he had underlying coronary artery disease. He had at least 3 blockages in his coronary arteries.
In Sam's case, certainly, given all his athleticism, he was very surprised, borderline shocked by it. But I think he came around quickly because he knew that his body was not doing as well. He wasn't responding as well, so he needed something.
Well, the care from the time I got in to see Dr. Sailam, it was enormous.
In the United States, only about 5% of bypass operations utilize both arteries from inside the chest wall, the mammary arteries. We were aggressive. We used both arteries from inside his chest wall. We did not use any vein from his leg, which is typical in most bypass procedures. But we know that by using both arteries, it prolongs life and it reduces the risk of reintervention. And we did that in Sam because we knew Sam was otherwise perfectly healthy.
My first memory of waking up in recovery was Dr. Martella there. The next morning, Dr. Blaber was there to check on me. The critical care unit at Lourdes was phenomenal. All the nurses, it really was a well-practiced machine.
We look at people differently. We don't just look at them as patients. We look at them as people having their worst day.
It's a big surgery and the recovery was a long time, but I also feel very fortunate with all the support I've gotten and that I think I've got a much longer, healthier life as a result of having had the surgery, so I feel great about that.